मैं फुल बनना तू तारा सजना, कल्ला ते कवारा सजना, मिलना चाहूं दोबारा सजना, फेर ना ला दी लारा सजना, मिट्टी दा बन ढेर मिलांगे, हाय नी आपां फेर मिलांगे, कदे ना कदे फेर मिलांगे, हाय नी आपां फेर मिलांगे, कदे ना कदे फेर मिलांगे, हाय नी आपां फेर मिलांगे। रब जाने कद मिलना ए नी कच्चे पक्के राहां ते, तेरे ते यकीन बड़ा पर हुंदा नहीं ओ सावां ते, पलकां वी ना बंद करा तू सामने।
Today, we witness the incredible strength and determination of our brave SCI patients as they take their first steps towards independency. These are not just steps across a road, rather, they are giant leap towards freedom, self confidence, and a life redefined. It's an achievement that goes beyond the clinical wall. It's a testament to their resilience and the power of rehabilitation. Every person in this group has faced unique challenges, but today they are confidently navigating the bustling street independently. It's a privilege for Spinofit Plus to work with these amazing brave individuals. Together, we have embraced this transformative journey of recovery. And hence, let us celebrate these victories, big or small, as we witness the collective strength of human spirit. Today, we just don't see a group crossing the road, but we witness the power of courage and determination, and an enthusiasm and an incredible possibilities that lies ahead.
Here is our acute stroke patient Maruti Biradar, 47 years old, who is now performing lunges which facilitates proper weight shifting and control over balance, also strengthens hip, leg and core muscles. Thereafter, he is doing half kneeling to standing, aiming in proper weight bearing on the ipsilateral side, torso stability, and brings out active mobility of the hip flexors. It also improves balance and stability in stroke patients. Now, in this clip, he is performing forward and backward walking by the side of a zigzag placed rope. This improves motor and cognitive abilities simultaneously with continuous command in stroke patients. Now he is stepping and jumping in trampoline for developing balance and coordination. It also improves pelvic floor musculature and also beneficial for joints and proper weight bearing on the affected part. Lastly, he is balancing on reverse bossy ball, training both static and dynamic balance as well as training motor skills, kinesthetic awareness, and proprioception.
ऐ भारत माँ तेरी माटी तेरा देश पहले, दुनिया के सारे सुख पीछे है मेरा देश पहले, है तिरंगा शान अपनी, देंगे इस पे जान।
அன்பு தருவாரே சின்ன அறிவிப்பும் என்று சுடுவாரே நீயும் தும்மிரடி ஆயுசு நூறாக என் உயிர் உன்னோட பொத்தி வச்சுட்டாரே என் பார்வை உன்னோடு உன் பொம்மை கண்ணோடு பேசாமல் விண்ணோடு நாம் மிதந்து போவோம் காதோரம் அடியாதோரம்.
The feds is watching, niggas plotting to get me. Will I survive? Will I die? Come on, let's picture the possibility. These niggas got me tossing shit. I put the top down, now it's time to floss my shit. Keep your head up, nigga, make these motherfuckers up and let these devils be sorry for the day they finally free me. I got a caravan of niggas every time we ride, hitting motherfuckers up when we pass by. Until I die, live the life of a boss player. Cause even when I'm high, fuck with me and get crossed later. The future's in my eyes. Cause all I want is cash and things. A 5 double O, bands wanting flashy friends. Bitches pursue me like a dream. Been known to disappear before your eyes, it's like a dope fiend.
We got palm trees, pretty bitches and bomb weed. Straight out of Corona, yeah, the crap of the IE. I hustle for the rock, get money all in my white tee. Them 4th Street boys, they put you on the IB. Sick motherfuckers kicking gangster music. All different neighborhoods and it's shot by exclusive. From the crown to Riverside, from the P to the Ville. And all the hoods in between, boy, you get your cat filled.
Yeah, it's your boy Big Tams, County of Riverside, Mira Loma.
Jumping is a coordinated, heavy work activity that promotes motor planning, balance and coordination, muscle development, and improves in bone density. While jumping, the joint receives a pressure input, and this proprioceptive input helps the child become more aware of his body. It is an advanced child development skill that requires lots of strength and generates high force into the joints. It also trains bone strength by exerting a required amount of stress onto the bone while landing, which is very beneficial for gait training in CP children. It also helps in improving mobility and stability of the lower limb joints, starting from ankle, knee, and hip, which will help in improving his range of motions and also aids in posture correction.
Our patient Suraj, case of cervical spinal cord injury, is performing trunk flexion extension in high sitting, aims to improve his sitting balance. In this clip he is abducting his shoulders till 90 degree and taking it back, aims to improve his abductor strength. In this another activity, Suraj is hitting a ball in high sitting, aims to improve his sitting balance. In this clip, he is performing assisted shoulder flexion and extension, aims to improve his strength of flexors. In this another activity, we are teaching him a component of supine to sit which aims in improving his bed mobility. In this clip, patient is moving a PVC over another PVC which aims in improving his strength of abductors and adductors. In this clip, Suraj is performing the same activity in high sitting.
In this video, our patient Hemant, SCI level C5-C6. Here the patient is sitting on the abductor machine and is performing trunk extension, which increases the back extensor muscle strengthening. Here he is performing an activity on the hip glute machine with added weights, which aims to target the core, glutes and quadriceps. In this next activity, he is performing side bends which targets the obliques and is a useful means of functional stretching. In this activity with the legs abducted, we ask the patient to throw a tennis ball aiming at the stumps. Here we aim to increase the shoulder ranges with the throwing motion and strengthen the hand grip with holding the ball.
This is a case of a 35-year-old male, SCI injury level D12L1. Here in these activities, we are doing upper limb standing, which is combined with thoracic extension in a prone lying position. Then the patient is commanded to do various shoulder movements, like here he is doing shoulder flexion. Similarly, we can modify these activities by using TheraBand and do shoulder retraction, which mainly targets middle trapezius and rhomboid. In a high sitting position, we can specifically target sitting balance by training hip control through these simple functional activities. With the help of push-up bar, we can train weight shifting. These activities not only help in achieving sitting balance but also strengthens arm muscles.
Here, we are performing activities that aim to promote static sitting balance. Taking the ball in forward, backward, and upward motion challenges sitting balance. Another modification is using a 2 kg medicine ball in oblique direction, which targets core strengthening along with sitting balance.
Our patient Yash, 17 years old, case of cerebellar ataxia, is performing forward bending in standing and raising 2.5 kg dumbbell in each hand, aiming strengthening of core and upper limbs, flexibility of spine, and overall body balance. In this another activity, he is performing caps and cones reach outs in standing to attain static standing balance and hand eye coordination. Here in this clip, he is propelling a 15 kg weighted box with kneel walking to achieve hip stability, core strengthening, and overall trunk balance and stability. Now, in this clip, he is performing abduction and adduction for abductors and adductor strengthening and to increase range of motion. Lastly, he is walking in assistance with walker to boost his confidence and to work on multiple muscles at the same time. Walking plays a crucial role in ataxic patients as it involves leg-eye coordination, balance and stability of the entire body.
In this video, we will see few exercises which are mainly targeted for hip balance and back muscle strengthening. In the first activity, we will put the patient in a quadruped position. We can secure this position initially with the help of a peanut ball, and once the patient gains some stability and confidence, we can remove it. We can also use a bolster and place it just close to the knee joint so as to prevent any kind of back slip of the foot. And in this way, with the help of caps and cones activity, we can promote hip balance. In the second activity, the patient is asked to do bridging. Here we are assisting the movement initially with the help of a bar and a TheraBand. This activity helps in activation of glutes and core muscles and thus helps in hip balance. Third activity is pushing the wheel. In this activity, the patient is in half-lying position, that is the upper half of the body is bent at the hip level and the trunk is raised from line to any angle up to 30 to 40 degree as per the comfort of the patient. Then the patient tries to push the wheel in a forward direction and alongside tries to elevate his upper body so as to achieve a sitting position. This activity majorly targets the core muscle strengthening and also provide trunk stability.
Our patient Mayuri, a case of Friedreich's ataxia, is working on performing lunges. Lunges will target lower extremity strength, core control, balance, and weight shifting, which will help in everyday ADLs like bending, reaching, and transfer tasks. Here we are performing stair climbing with weights. It is known that in ataxia, axial weighting, in this case to the ankle, is known to improve gait in ataxic individuals. Stair climbing will require balance, body stabilization, and simultaneous coordination of bilateral limbs. It has the following benefits of decreasing the sway, increasing joint compression, which is going to facilitate co-contraction of muscle and provide stability. In the next activity, our patient is performing kneel walking. Kneel walking both forward and backward with holding a bolster in her hand. This will help in increase trunk stability, core stabilization, trunk strengthening, and strengthening of the extensor group of muscles as well. Walking with a bolster provides dynamic gait training with added weights to provide stability.
alone.
Our patient Satish, 60 years old, case of lateral medullary syndrome, is performing mini squats on Bosu ball, in which the unstable surface forces him to balance and also promoting knee and ankle mobility. In this another activity, the patient is performing weight shifting on either side on Bosu ball, promoting knee and ankle mobility while challenging his balance. In this clip, the patient is walking over the trampoline. This activity will help him improve balance, dynamic gait, and also improve his falls efficacy. In this clip, the patient walks stepping over the obstacle, which will help him improve gait velocity, stride length, walking endurance, and obstacle clearance capacity. In this clip, we can see the patient is enjoying cricket. This gaming approach promotes repetitive task-specific training and active engagement of patient, enhance neuroplasticity of brain and motor relearning.
This is our patient Ravindra, 39 years old, case of SCI level L2 L3, who is now performing forward and side crunches with a 5 kg medicine ball over wedge board, aiming at his core, obliques, and QL strengthening in the side crunches. In this next clip, he is in prone lying over wedgeboard and pulling a 13.5 kg resistance loop and also raising a Swiss ball, targeting his scapular muscle strengthening, posterior capsule stretch, upper back strengthening, and shoulder mobility. Now in this clip, he is performing side crawling with weights tied on his thighs to add on strength training. Crawling work out our entire body specifically for weight bearing on hands and knees. Here in this clip, he is executing prone to quadruped transition in order to achieve shoulder stability, core and upper limb strengthening, postural alignment, and overall motor control. In this another clip, he is performing kneel sit to stand, aiming to achieve pelvic balance, knee weight bearing, strengthens core, glutes, and to lesser extent hamstring and quads. Lastly, he is doing side kneel walking by pushing box with 15 kg weight on it, targeting hip, spine, and overall trunk balance. It also emphasizes in core stabilization.
Here are few exercises which can be done with van for the upper limb strengthening. In the first exercise, the patient is commanded to do shoulder flexion. This majorly targets our anterior deltoid, coracobrachialis, and pectoralis major. In the second, he is holding the van horizontally over his head and commanded to do side bend. Here, the patient is pushing the van forward with resistance band attached on either side, which is challenging the task. The major muscles involved here are triceps, pectoralis muscles, and deltoid. Similarly, we can also ask the patient to perform the same movement in different directions. Like here, he is pushing the van in forward and downward direction, which can also be done in upward direction as well, so as to target the specific group of muscles necessarily required for oval or shoulder muscle strengthening.
In this video, Master Avyan's 6-year-old child, a case of right hemiplegic CP, is standing on a Bosu ball and performs a fun caps and cones activity, which is a compound exercise that targets weight bearing on his right leg, right knee locking and unlocking, dynamic balance, right upper limb functional activity. Similarly, this exercise can be modified by adding a single leg standing challenge, which has the following advantages of improved proprioception, increased weight shifting to one side, and increased body awareness. The next activity is a similar variation of the above exercise that challenges dynamic balance, weight shifting, and lower limb strengthening via squats. In this activity, we are using a trampoline and asking the child to jump on the trampoline, which acts as a fun activity that will facilitate increased proprioception, unilateral leg weight bearing, knee locking and unlocking in the weight bearing leg in close kinematic chain. In this activity, we are asking the child to kick the ball with a weight cuff attached to the affected extremity. This aims to target single leg standing, gross motor skill of kicking, along with functional strengthening. Another activity that aims to promote active dorsiflexion of the affected foot along with functional strengthening of the affected leg using weight cuffs is uphill walking on the wedge board. The same activity can be modified by asking the child to step forward and backward with the unaffected leg and continue.
Let us discuss few most important benefits of hanging in SCI patients. Number 1, it decompresses spine, which improves in fluid circulation and reduces pressure inside the disc, and thus helps in proper intake of nutrients and proper blood supply to the brain and spinal cord. Number 2 is posture correction. ACI patient mostly develops scoliotic posture, thus while doing this activity, it also stretches out the upper body, hence aids in posture correction. Number 3, it strengthens scapular muscles. In this case, the patient has developed winged scapula, and thus by doing this activity, we can stabilize the scapula and bring it back in its normal position.